Hi, I'm Paul, and I'm going to show you some excellent exercises for helping with hip mobility. This first one I'm showing you here is called Malasana pose. It's also called garland pose. And the idea is I'm trying to drive my hands together to create external rotation in my hips. It's a nice drill. You can do it for a minute or two. It's really helpful to create a little extra hip rotation. Another common yoga pose is bandha konasana. Basically grab our feet and try to open up our feet as we pull down. You can also grab the bottom of your feet to get a little more torque. We can also grab our feet and push down to our elbows. And if I want to get some lower back, I can also slide my hands underneath my feet and pull down. All of these really help for creating a little bit of extra hip mobility when we're going to do some more distraction type exercises. So I have a green exercise band here. It's about 1 inch thick or so. You can go up to about 1.5 inches. And for the first exercise, we're going to put the band right here on the top of our hip, right below our pelvis, and step forward. This pose looks a lot like pyramid pose, and indeed it's almost the same. But when we put the band here, it creates a distraction force that pulls back against our hip. I want to stay here about 1 minute or two, really loosen up everything in the acetabulum and femur joint. The next stretch I'm going to do is a modification of Samson's stretch, in which we're going to pull up the band to the back of our pelvis here, and I have it still on my femur. Slide the band down a little bit, and then we're going to just step back. And then we lean forward and lift up. And this looks just like Bondasana pose. Indeed, it's very much the same pose. I can also keep both hands down to create a stretch here. The next pose I'm going to show you is called the reverse ballerina. I learned this one from one of Kelly Surrett's courses. Band is sitting here, pulling forward, and then we're going to lean back. And the band pulls the femur head forward, reseating it in the hips capsule. Again, 90 seconds to maybe a minute or so to do this one. Next one we're going to do is a really good one if you're dealing with any kind of hip impingement syndrome. So what I'm doing is I'm kind of positioning the band all the way up here in my groin, so right at the top of the femur head, and then I'm going to kind of move out a little bit. And then once I'm here, I'm just going to move the joint up and back. Really excellent technique for helping make sure there's no gliding in the joint and it's rotating in the socket like it's supposed to. You can also grab the knee and twist, and you'll feel the stretch on the outside. The last stretch I want to show you is a modification of our figure 4 stretch. And so, same idea, band still low in the hip socket, and we lean back. To add additional leverage in this stretch, and if you're more flexible, you can also kind of reach underneath your leg and pull the leg up. And then the band helps distract the hip. So I'll feel with the band down here as opposed to the top. And you want to stay here again, 90 seconds to a minute. All these drills will help a lot if you're trying to improve your basic air squat position and get down cleanly without any kind of knee pain or hip pain. Thanks for joining us. Again, I'm Paul with Stand Still Fitness. Thanks.